question usually say this guy was a military guy or stayed in a place where there's a loud noise and all these things, right? All of a sudden. It happened right after sudden, extremely loud noise can produce, okay, hearing loss due to tympanic membrane rupture. Like I'm a survivor. So many slap, I got it from my dad, nothing ruptured my tympanic membrane. So my tympanic membrane is strong. Not one, not two, it's countless, right? If I really think about it, more than 20, 30. If he does that now, I will sue him that my tympanic membrane is ruptured. It's crazy. So that's noise-induced hearing loss, folks. Next one, presbycusis. It is an age-related progressive bilateral symmetrical sensorineural hearing loss. We're going to talk about what is sensorineural, what is conductive and stuff, but let's see. These are often of higher frequencies due to destruction of hair cells, folks, okay? And preserved low-frequency hearing. So these people can hear low frequency, but not high frequency, okay? That's the idea. That's that, folks. Now, you're not talking about low frequency. What is low frequency? Small talks, quiet talking, isn't it, folks? Now, if you really think, when somebody is talking very quietly, you could hear if they are next to you. As they go, you lose their voice, isn't it, folks? That's a normal behavior, right? I'm just want to tell an interesting fact. I don't know if how many of you have a dog at home, and they say dogs can hear low frequency for miles. So somebody can talk quietly a mile away, the dogs can. That's why they say the dogs can sense better about certain things than other people. Does that make sense, folks? Like the dogs sense certain things, right? So even some birds can sense it when it's about to rain. They know a few minutes before. Okay, so just to talk about it, okay? So that's that. All right. Now, before we continue, we need to talk about how do this physical exam works. Now, it's very difficult for me to teach this without a practice, folks, okay? These are usually taught on a physical exam when you go and learn. But I'm going to try my best to get this sense with talking here. So hopefully with this information, when you go to physical exam, you will learn better. Now, whenever you do the test, we use the tonic fork and then we do that test, right? Now, this is the first, this is the second. That's how it needs to be done. You always have to do Rainy test first before Weber. If you do Weber first, you're not going to get a conclusion. You're going to end up rolling around again 3 times, okay? So always do Rainy test first. Now, let's talk about normal here, folks. So the tonic fork, we take it. There are different ways you could do it, but I'm going to go how we were trained. So what we do, we tap the tonic fork. I'm going to keep it next to the ear. So we tell the patient, I'm going to do 2 locations. I want you to tell me which one you feel better. So location A, it's right next to your ear, folks, okay? And then location B, we're going to place it on the mastoid bone, okay? So A next to the ear canal, B on the bone. I'm going to do that. I'm going to ask them which one you feel better or hear it better. They usually say, this is better than the bone. So we call this air and this is bone. So air conduction is better than bone conduction. That's the normal finding, folks. Okay, that's your normal. Okay, so you should be feeling that vibration through the ear canal better than the bone. That's normal. Is everybody clear, folks? All right. Now, that's Rainy test. Once I do that, then I'm going to do that again. You could keep it in the middle here, keep it middle, keep it anywhere in the midline, you could keep it. So I usually go for here in the midline or even here in the middle, folks. So exactly in the middle here, right? So the minute I do here, that's a Weber's test. Now what that Weber test is do, it's vibration of that tonic fork is spread equally on the bone to the ear. Is that clear, folks? So it will be no localization. What does that mean? In a healthy people, when I keep it here, I would feel it equally on both sides, not one side more than the other side. Is that clear, folks? So that's Weber test. Okay. Now, where most of the students get confused is the Weber test, not the Rainy test. So how does Weber test works? Weber is going to favor where you hear more bone. They always favor bone better than air. Is that clear, folks? I want you to understand that. Because I'm not hearing here, right? I'm feeling it. I'm keeping it in the bone. When I keep it in the bone, it's going to go both equally because both of my ears are normal now. Is everybody clear, folks? Okay, so that's Weber test. So that's normal finding. Is everybody clear? Now, let's say patient comes to me. I don't know whether they have conducting hearing loss or sensory neural. We don't know that, okay? First test we're going to do Rini test. So I'm placing here location A, location B. This patient says they feel better with location B than the A. That means they feel bone better than the air. Bone better than air. Is that clear, folks? That tells you simply something is blocked in my ear canal, that they are not able to transmit the sound. Is everybody clear, folks? So the minute you see here, that's a conducting hearing loss. Bone conduction is better than air is always conductive hearing loss. Is everybody clear? Bone conducting is better than air. It's a conductive hearing loss. So repeating one more time. I'm feeling the bone better than through here, which is abnormal. That means there's something blocking in my ear canal. Is that clear, folks? All right. Now, keep in mind, this is my right side. So I have almost confirmed that right side has a conducting hearing loss. Is that clear, folks? Now, when I go to the left side, I feel this better than this, which means my left side is normal. Is that clear, folks? Okay. So let's say I go here. This is my face and that's my ear. Okay. All right. That's the right side. That's the left side. Now on right side, I have bone conduction better than air conduction. On the left side, I have air conduction better than bone conduction. So which means this is normal. This is conductive hearing loss. Is everybody clear, folks? Okay. Now, I'm still not 100% confirmed yet. I confirm 90%. I still have to confirm 100%. Now, before I do the Weber test, I just want you guys to tell me, if I place the Weber, which side Weber will go more? Towards the right side or left side? It should go towards the right side. Why it should go to the right side? Weber always favor where there is more bone conduction. Is that clear, folks? In this patient, which side do you have more bone conduction? Right side has more bone conduction than the left side. Is that clear, folks? So where do you think the Weber will go? Towards the same side of my problem. Is that clear, folks? Write this down so you will not confuse right after that. So the Weber will go towards the same side. Same thing the book is saying. Look at that. Localizes to the affected ear, folks, okay? The same side. So then I'm confirming 100% this is a conductive hearing loss. Did we get that right, folks?
When you say something is blocking the ear, what did that mean? Like, is it infection or is it something else? Like,
anything that blocks, right? So that means there could be a foreign body, there could be an earwax 100% blocked, it could be a tumor mass, something in your ear canal all the way.
It wouldn't be like anything structural inside there, right?
You could have the bone fibrosis, that MIS, that's structural.
Okay.
On my mom's side, there's a really strong hereditary hearing loss. And one of the things that they, as they age, one of the things you see is the opening of the external ear canal gets smaller and smaller and smaller. And so I think it's like some sort of bone growth, that bone changes that makes when you try to look and examine the ear, the opening is just so very small, but it wasn't like that when they were younger. So it's part of their hearing loss on my mom's side of the family. It's interesting.
Wow. Is there any way to prevent that? Can they put a tube or something to prevent the bone closure?
You know, I have no idea. I don't know.
Oh, I think these are ENT subspecialties. I don't know. I should ask. I have an ENT friend. Find out. Yeah, because that's because true. Wow, you see, that's why they say medicine. What we learn is about 10% of the whole medicine, right? There's so much that we don't know what happens. Wow. So that's conductive hearing loss. Is everybody clear, folks? All right. Now let's go to the next one. This is the problematic one. Let's get this one. So that's a conductive hearing loss. We will use the same drawing. Okay. So you have this, that's a right side. This is the left side. Okay. This is the right side and left side. Now here, patient is coming with the symptom of hearing issue. So they come to you with the symptom of hearing issue. Okay. There is something, the patient comes and complain with you. Now I am doing a test on the right side, same right side. I'm doing the first Rini test. I found out air conduction is better than bone conduction. Air conduction is better than bone conduction, folks. Okay. Now, here you will ask me, isn't it normal, Dr. Roy? It is normal only if they don't have any symptoms. As long as they have a symptom, that is not considered normal anymore. Is that clear, folks? So for this right side, they have symptoms. And when I do the Rini test, they have air conduction better than bone conduction. So even though that's a normal finding, but they have symptom now. Is everybody clear, folks? Now, when I go to the opposite side, because of this air conduction problem, in opposite side, they're going to have bone conduction better than air conduction. This is a normal finding because on the right side, patient has an issue, the left side will become a little bit oversensitive. Is everybody clear, folks? Okay. Or I wouldn't even say the left side even have a conduction. I would literally say the left side is also normal. They have it in a way normal. I don't have any problem on the left side. Is that clear, folks? So the patient's symptom is only one side, right side, and the left side appears normal. Okay. But at least you should know the right side has less bone conduction. Is everybody clear, folks? Less bone conduction because air conduction is more than bone. Did everybody get that, folks? Now, when I place the Weber in the middle, which side do you think they will go towards? They will go towards left side. Why do they go towards left side? Right side has less bone conduction. Remember, Weber goes where there is more bone conduction. Okay, Weber always go where even though left side has normal, their bone conduction is much better than the right side because right side has decreased bone conduction. Is that clear, folks? So how do you put that in the book? It localizes to unaffected ear. Okay, so the bottom line here, folks, if Rini test and Weber test are positive on the same side, that's conductive hearing loss. Is everybody clear? If Rini test is positive on one ear, Weber goes to the opposite side, that's sensorineural hearing loss, period. Why sensorineural goes to this side? Because here the bone conduction is better. So that's a normal side. So they always go to the bone conduction side, folks. Is everybody clear here? Okay, so let's do a problem here. I wanted to make sure. Patient comes with left side issue, left side. Left side has bone conduction better than air conduction. Okay, left side has bone conduction better than air conduction. So that's Rini test positive. Okay, when I do Weber test, what will happen? That will also go towards the right side, left side. What type of hearing loss is this? Type, everybody. What type of hearing loss? That will be conducting hearing loss because all of them are to the same side. Is that clear, folks? That's to the same side. Does everybody get it? So if your Rini test and Weber goes to the same side, it's conductive. If one is positive one side, the other one goes to the opposite side. That's sensorineural. Clear, folks? Okay. See, it's very hard without practical, but we try to manage it. But now when you go for clinical rotation and you started seeing patient and you do that, that's where you become good at it. Okay.
Is conductive hearing loss basically like if you have earwax or water stuck in your ear, you notice like if you hum, you hear the humming louder on the affected side? That's basically because of the blockage?
That's basically you're popping that pressure. That's the idea. But when you have water in those things, it's not really a conducting hearing loss, but that would say temporary hearing loss. Like sometimes you have the whole ear is full of water if you come from the pool, right? So that's technically for a few minutes, it's conductive hearing loss.
Okay, thank you.
Yeah. So the conductive hearing loss are problem in the ear canal. Sensorineural mean problem with the nerves. Okay, problem with the nerves. That's the idea, folks. That's a 2 type of hearing loss. Any question for me? All good. Okay. At least you guys know what is Weber test and Rainey test, folks. When I passed step 1, I had no idea what to do this because we were not taught this. We only learned this on the 3rd year when we do clinical rotations. First time we learned these things on the clinical rotations, right? At least you guys see now when you go to clinical rotation, when they talk about this, you know the basics. Any question for me?
Do they usually ask these type of questions, or
They might. I mean, since they are putting it, they might ask how to differentiate conductive and sensory loss, but it should not be a problem, right? So we have it simplified. That's easy. Okay. Now, next, cholesteatoma. Those basically abnormal growth of those keratinized squamous epithelium in the middle ear. Some tissues are there. Usually acquired, or it can be congenital, folks. Sometimes it comes from the tympanic membrane retraction and all these things. These are in your ear canal problem, okay? It can cause conductive hearing loss. That's what, at the end of the day, you need to know, folks, okay? Then I don't think they would ask you these things in the exam because it's too special ENT, but anything that happens in the ear canal, earwax and all these things causes conductive hearing loss, folks, okay? Now, that's why one of the things they say that you are not supposed to clean your ear with earbuds. You know that people use this, that you are not supposed to do that, folks. You push it inside when you do it, okay? We see it in kids. Whenever the kids comes, that sometimes we see so much of earwax that it can build up eventually, right? Now that's that. All right, that take care of that. Now let's go to one of the big topic, vertigo. In step 2 CK, you will spend the whole day talking about this topic in one system. It is a huge topic. Now, when we talk vertigo, it is different from dizziness because when patient comes to you, they're going to tell that they feel dizzy or lightheaded, okay? They both feel similar, but vertigo is divided into 2, peripheral and central, folks, okay? Now, how do you differentiate between these 2? Sensation of spinning while actually stationary. What is that? What is that, folks? When the patient comes to me, and if they say that they feel dizzy, I ask this question. When you stand up, do you feel like you are spinning in the room, or do you feel like the room is spinning? Here, when they stand up, they feel like they are spinning in the room, folks, okay? They are spinning in the room. That's vertigo. If I tell, when I stand up, I feel the whole room is spinning, I am drunk. That's what we feel. That's basically what it is, folks. That's lightheadedness, okay? So here, these people feel when they stand up, they are spinning, they lose the balance and they fall. Why do you think they come to the hospital? They stay home to see if they get better for a few days. If not, we will go to the hospital. Why do you think they come? They come for trauma. They walk on a driveway with this, they fall on a concrete floor, hit the head, they come for that. Most of the time when we meet people, that's why they come there with a concussion. Then they tell, this is what I felt right before. Some people are smart. The minute they have vertigo, they will come to the hospital or they will stay in the bed and call 911. Does that make sense, folks? Now, vertigo, it's so easy. But when you have it, it is one of the most unpleasant feeling people can have it. Because when you have vertigo, folks, think about it, you feel like you are spinning. That means your balance is messed up. Nausea, vomiting. Oh, it's not a pleasant feeling when you have it. Okay. I rather have a fracture than taking these things. Okay. So that's that. So that's vertigo. Is everybody clear, folks? Now, two things. How does your body is balanced? Your body is balanced by two organs. One is your ear, inner ear. Other one is your brain stem. Inner ear is called peripheral. Your brain stem is called central vertigo. Okay. So that's your physiology. Let's talk about your physiology first. So if I'm sitting here, folks, let's say I'm going this way. That means the fluid in my ear, inner ear, it turns this way, it balances according to my head movements. Does that make sense, folks? So that means as I am moving my head, that fluid also have to keep up with it. Is that clear, folks? If there is a balance, slowness or delay between my movement and the fluid movement, that's where the vertigo comes to play a role, folks. Okay. Now, some people are good at going in a roller coaster ride. Some people cannot handle it, right? I cannot handle roller coaster. Why? I have this issue that when the roller coaster go in a different angle, I get dizzy. Why? That fluid cannot keep up with that speed. So there's a little delay to causes that balancing. Does that make sense, folks? So that's the most important, right? Every movement we do, the fluid has to balance. Okay. So that's peripheral vertigo if there's a problem in the ear, or central vertigo. We don't know when the patient has vertigo where the problem is. We have to do testing to find out. Now, if you see here, peripheral vertigo is due to inner ear pathology. There's some semicircular canal derbis there. The word BPPV, right? That's how we call it. Benign paroxysmal positional vertigo. Okay. Vestibular neuritis, Meniere's disease, any of those things can cause it. That means, sometimes I always tell people when you have ear infection, don't take it easy, because if you have ear infection, you didn't cure it properly, that will develop into vertigo, folks. Okay. Triad of vertigo, sensorineural hearing loss, tinnitus, all these things, folks. That's your peripheral vertigo when it happens in the ear. When it happens in the brain, it's a brainstem lesion, either stroke or something else is happening. Guess what? There is no treatment for central vertigo. These people are stuck if they get central vertigo throughout their life. At least peripheral vertigo, you could figure out a treatment, do something and take care of it, but not. But most common is always peripheral. Very rarely people have. So that's a balancing problem. Okay. So that's the vertigo, So before we move on, once I went for the carnival that happens in each town. There's one of those roller coasters, remember, that's like a circle. They put you in like a person, they lock you and it goes in a circle so fast, like this. So I was like, my wife pushed me. So I was like, okay, let me try it. I went in there. So once you are there, you have to hold both of the hand. And then they pull, because it goes so fast like a circle. You can't let your hand go. So there was a girl across on opposite. And when she started rolling, I see it as it's going and her face didn't look good. She started throwing up. Going circle. I'm like 90-degree opposite to her. It was flying to my face, her vomit, okay? But the thing is, I cannot take my hands off. If I take the hands off, I will lose my balance. All I can do is close my eye and mouth. What else can I do at that point, right? It's all in my face. And I was able to tell what she ate for breakfast because it happened around 10 o'clock in the morning. So I kind of know what she ate it because I can smell the flavor. Okay. I actually did, I went up to her and asked, is this what you ate for breakfast? Okay. So that was the last day I went into any of those rides. And I told my wife, if you ask me, I'll shoot you again if you ask me to go on those rides. Because, that ride, you have no control. Once you start, you have to hold on to it. And she comes and says, sorry, her mom was like, sorry. I was like, of course, I cannot do anything. And then I was like, at least make me happy. Is this what you ate for breakfast? She's like, yes, okay. I just want to be right. That's all it is. Okay. That's because she had a vertigo. She didn't know once it started spinning, they lose the balance, folks. That day I decided you never do anything that you don't have the control of, right? When you go on a roller coaster, you don't have the control. Any of those ride, folks? Oh no, I will never forget that. All right, that's vertigo, folks, okay? Now, that take care of the ear. You see, they only touch base at very basics here because it's a step 1. When you go to step 2, see, there's the ENT separate topic. They talk all those things. All right, take a break and come back. We're going to start eye.
Dr.